Properly using the Akucal is very simple when it is done correctly. Today we will focus our attention on how to accurately attach and remove the Akucal from your table or bucky surface. And most importantly, we will review the appropriate steps to ensure accurate imaging results are achieved when using the Akucal. For best results, clean the Akucal and the table or bucky surface with any traditional disinfecting cleanser or wipe to remove any dust or debris before attachment. Position the patient, X-ray tube, and table normally. Once the patient is positioned and the exposure is ready to be made, we can securely attach the Akucal to the table or upright bucky. Place the base of the Akucal outside of the field of view. Extend the Akucal's radiolucent arm into the field of view, placing the sphere next to the area of interest at bone level. Verify that the entirety of the sphere will be visualized on the captured radiograph. When attaching the base of the Akucal, allow enough room for the arm to fully extend to the patient's area of interest. Placing the base of the Akucal too close to the patient's area of interest will require contortion of the arm. Contortion can be caused by making figure eights or other loops to lessen the arm's length. Continually bending the arm out of its normal shape can cause it to weaken or become damaged. Please note that the calibration sphere must be on the image at acquisition, and it must also be placed at bone level of the area of interest or the area that planning will be required. To attach the Akucal, make sure the suction cup lever is released. This can be done by simply lifting the lever up. Firmly press the base of the Akucal onto any flat, smooth surface. While firmly pressing, push the lever to the horizontal position. If your table or upright bucky surface is a textured material, please contact us about the smoothie surface strips. The smoothie surface strips make any non-smooth surface suctionable. Once the Akucal is attached, position the sphere by gently bending the flexible arm into place. Please note that the Akucal should be removed from the table surface or upright bucky after every patient. To detach the Akucal, release the suction cup lever. This can be done by simply lifting the lever up. Grabbing only by the base of the stand, depress each rubber tab to release the Akucal. Here is a demonstration of the Akucal removal without interruption. The following clips are only shown to demonstrate what not to do with the Akucal. Please refrain from ever reenacting these actions. The arm of the Akucal should never be used to assist in removal. Repetitively and forcefully removing the Akucal by the arm can damage the arm and/or base. If the suction cup does not immediately remove from the table or upright bucky after the lever is released, remember to depress each rubber tab to break the seal. Each individual site should determine a standard protocol for the preferred placement of the calibration sphere. This decision should be determined by the radiologist and/or orthopedic surgeon. Images can only be scaled correctly if the calibration sphere was placed in the image area while the image was exposed. Check your measurements carefully. False values can have serious consequences for the patient regarding misinterpretations of the right prosthesis size. The Akucal is meant to be used in conjunction with orthopedic calibration software to accurately measure an X-ray image in true size without magnification errors and to aid in pre-surgical planning. However, the Akucal is never to be considered a toy. Misuse or relentless tampering can cause damage to the Akucal. The Akucal was designed with the comfort and convenience of the X-ray staff in mind. Please treat the Akucal with the same courtesy as you would any other medical device. Please refer to the information and enclosed diagrams for further instructions on proper sphere placement and all other inquiries. Feel free to contact us if you have any other questions or comments.